This is a report by my colleague Martha Lacey. We have been particularly interested in pomalidomide and have treated over 150 patients. This is a study of 35 patients who were resistant or refractory to both thalidomide, or both lenalidomide, Revlimid, and to bortezomib or Velcade. In other words, patients who were pretty much at the end of the road, and we see that 31% of these patients obtain a partial response or better. This is a drug that's given orally and is well tolerated and shows great promise. Now, you might ask, have we made progress over the years? And I think the answer to that is an unqualified yes. And my colleague Shaji Kumar has looked at 2,981 of our myeloma patients seen at the Mayo Clinic since 1970 and divided them into two groups. Those who were diagnosed after 1996 and who had the advantage of an autologous stem cell transplant or the new drugs. The survival of these patients was 44.8 months compared to 30 months for those patients who were diagnosed before 1996 and were treated with melphalan, cyclophosphamide, and various combinations of alkylating agents. He also looked at our patients who had received an autologous stem cell transplant and had subsequently relapsed. Those patients who received one of the novel agents had a median survival of 30 months compared to 14 months for those patients who, for one reason or another, did not receive a novel agent. So I think this is strong evidence that we are making progress. And there's better news to come. I'm listing just 4 of the many drugs that are in early stages of development. These 4 drugs are further along into phase 3 studies. One, Ministatin, is a histone deacetylase inhibitor, SAHA. The accrual has been completed for a prospective randomized study, but the data has not been analyzed or reported. There's a new proteasome inhibitor, pt5 that can be given orally. Carfilzomib is a very exciting drug. This is also a proteasome inhibitor, and a large phase 3 study was started the first of this year, and already more than 100 patients have entered the study. And the 4th drug is the pomalidomide that I just mentioned a moment ago. So the outlook, I think, is very good and is very encouraging. Unfortunately, we are not at the point where we can guarantee cures or anything like that, but